And I agree we've got to protect our citizens. But at the moment, we lose more citizens to gang violence, we lose more citizens to road crashes than we are to COVID-19. We've shown that we are able to manage this pandemic, especially now as we've come down off the peak. And if I look at hospitalizations and I look at deaths, we are so far down now on the fourth wave compared to the third, second, and first wave that, quite frankly, we do not need a disaster declaration to manage it. You put disasters in place to protect your frontline, to protect your hospitals. We can do that. And so I think from October last year, I've been calling for a roadmap on how we are going to track our way out of the disaster into normalizing our management of this pandemic. And in actual fact, it's moving from a pandemic to an endemic situation where we must learn to deal with COVID-19 waves as they come. The next one should come around about us leading into the weather change going into winter. But if the statistics and the science are what we use to make decisions, well, then quite frankly, the decision should be to end this disaster declaration, because the consequences, just the consequence on our education outcomes is having a more devastating effect now than the pandemic itself. So quite frankly, we need to now move to living with the pandemic, putting our own responsible safety precautions in place. We don't need a disaster in order to do it.
The Health Minister, Dr. Joe Phaahla, citing world examples where countries thought they were over the worst, and yet they saw a resurgence and things got a tad bit more worse. Is there something to be said about that, do you perceive?
But you see, that's why you've got to get it into normality. So what we have to do is we have to say, when the waves start to pick up again, what are we going to do? Are we going to close down schools? Well, we are not going to do that. In the height of the peak of the third wave of the pandemic, schools weren't closed, they were open, although they were open with a 1 meter rule. Now, with the infections to hospitalization rate dropping from 16 and 14% and 12% in the last wave down to less than 5%, 4.5%. That says that we don't need the declaration. We are able to manage it. And of course, younger people can deal with this in a far better way than older people. And we've got older people who really are where the better percentages are on vaccines. So quite frankly, we can manage this without the declaration.
It would seem as if your calls have been heeded for a roadmap in terms of where to from here. We understand there is a meeting next week where proposals will be discussed. What will your submission be?
So I have already said that we would very much like to supply know-how or people towards those teams that are looking at this roadmap, and I did that last year already. We ourselves have also put together our own management system with traffic lights or trigger systems on what happens when infections get to X and Y. And again, we're applying the learnings now on the fourth wave, which has readjusted it again. So I will be submitting that. I've asked our cabinet to finish that discussion by next week. I'll submit all of those documents or the refinement of those documents to National at the same time as soon as we pass it through our cabinet next week. And again, open to saying, how can we help or how can we learn? Because we've got to be doing this together. We have some of the top scientists in the world. They've shown themselves to be better able than many other scientists across the world, time and time again in the last 2 years. We must utilize them and their know-how. I think sometimes we don't listen to them often enough. They really have proven themselves. And we need to then apply our minds to building this new future, which is going to have endemic COVID-19 waves going into the future. We've got our management tools in place. And now we need to focus on recovery, the economy, changing our society from being, the highest youth unemployment in the world. Those are the kind of focuses that government need to be putting their eyes on, because we've shown that we actually are able to manage the pandemic.
Mr. Winde, you mentioned gang violence and perhaps road accidents, claiming more lives than COVID for now, at least. What do you say to a thought that says, has the city of Cape Town dealt with such hotspots such as, the Cape Flats adequately? Because this was a situation that we had even before COVID. And had you given it enough attention that it deserves? There's been some criticism meted out against the city that those areas have by and large been ignored.
So I've been in this position for 2.5 years. When I came in, I said that safety was a big priority of mine. I have advocated how I think we should change policing in our country. I think there should be a constitutional change, and the mandate should change from a national to a provincial level on policing management with oversight at a national level. At the moment, the Constitution says provinces have oversight over national police. That system doesn't work because the national government just assume that center and that control. But in the absence of us getting that change, I've put in more money now than any other province into policing. We've now got 1,000 extra sets of boots on the ground, and we only focus them on those crime hotspots, on the murder hotspots. So the 10 murder hotspot police station areas, which actually happen to all be on the Cape Flats in our province. Interesting, the minister was forced to report in Parliament at the end of last year that the only province in South Africa where the murder rate is coming down is in the Western Cape, and it's coming down where we are investing in these extra boots on the ground. We're doing it in partnership with the city of Cape Town. And just that little bit of a difference that we've actually managed to bring, the 20,000 police officers in our province, we've added 1,000 more. And already you can see a difference with a focus on management on saying how do we bring down the murder rates in those hotspots. And, I've set it as a 10-year target of how do we halve the murder rate because we cannot tolerate this anymore. It cannot be run the way that it runs. And I'm pretty certain that it's actually ruffled a lot of feathers in what we've done, and we will keep pushing that. And I still believe that we should change our system. We can't keep doing the same things over and over again with getting the same results. If that doesn't change, we've got to reinvent the system. And